Welcome to the latest edition of Hematology Updates, covering recent breakthroughs in the field. Brought to you by Lucid Quest. The European Commission approved Minjuvi, tafasitamab, with lenalidomide and rituximab for adults with relapsed or refractory follicular lymphoma after at least one prior therapy. This chemo-free CD19 and CD20 dual-targeted triplet is supported by the Phase 3 InMind study in 654 patients, showing a progression-free survival benefit versus placebo plus lenalidomide and rituximab, with safety consistent with the components. Expect new competition that could shape pricing and formulary access. The FDA granted accelerated approval to subcutaneous Lunsumio mosunetuzumab for third-line or later follicular lymphoma. In the Phase 1, Phase 2 Go2-9781 primary analysis, overall response rate was 75% and complete response was 59%, with cytokine release syndrome mostly grade 1 to 2. Administration is about 1 minute by injection, compared with 2 to 4 hours for intravenous infusion, which may influence prescriber choice and payer reviews as more data mature. The NCCN added duvelisib, Copik-Tra as a Category 2A option for mycosis fungoides and Sézary syndrome in cutaneous T-cell lymphoma, reflecting panel consensus above 85%. Duvelisib is already FDA approved for relapsed or refractory CLL or SLL, and this guideline inclusion can inform practice and payer discussions as adoption progresses. The FDA granted Orphan Drug Designation to Roxadustat for myelodysplastic syndromes. A post-hoc Matterhorn analysis suggested a transfusion independence benefit in a subset with high transfusion burden. The designation aligns with plans to finalize a Phase 3 protocol, signaling continued investment in this program. Johnson & Johnson submitted an EMA application for teclistamab combined with subcutaneous daratumumab in relapsed or refractory multiple myeloma after at least one prior therapy. Phase 3, MajesTEC-3, in 587 patients, showed significant improvements in progression-free and overall survival versus DPD or DVD, with infections noted for clinical management. This off-the-shelf BCMA and CD38 combination aims for earlier line use and could guide treatment selection pending review. Syndax and the World Orphan Drug Alliance launched a multi-regional managed access program for Revu4J, Revumenib, outside the United States where regulations permit. Geographies include parts of Eurasia, Europe, Israel, the Middle East, Turkey, Latin America, and Africa. The program could broaden access to this FDA-approved menin inhibitor for specific relapsed or refractory acute leukemias, and support screening, initiation, and follow-up at scale. China approved sonrotoclax for relapsed or refractory mantle cell lymphoma and for relapsed or refractory CLL or SLL. Phase 1, Phase 2 data presented at ASH showed an overall response rate of 52.4% in mantle cell lymphoma, N equals 103, and 77% in CLL or SLL, N equals 100. This first-in-world approval for a next-generation BCL2 inhibitor, alongside ongoing US priority review for MCL, may reshape pricing and formulary dynamics. Takeda and Protagonist submitted a US new drug application for rusfertide in polycythemia vera. Phase 3. Verify met the primary and all 4 key secondary endpoints with weekly subcutaneous dosing. The application seeks approval for hematocrit control and reduction of phlebotomy burden, which could meaningfully affect patient management if approved. Stay ahead in hematology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.